In January 2020, the World Health Organization announced a new coronavirus variant is a matter of international concern. By March, the virus spread around the world. As the death toll in the United States climbed, the White House declared COVID-19 a national emergency and local governments rushed to respond to the crisis. Policies needed to be put in place immediately to save lives. One frontrunner in public sector response was Jenna Bilinski, COVID-19 Command Center Operations Chief at the San Francisco Department of Public Health. Bilinski entered her new role in February 2020, thinking it would be a short-term job shadowing the current operations director. Instead, she learned that she would be taking over as operations chief immediately, overseeing more than 470 people from a variety of city agencies. The first thing the team focused on was protecting the most vulnerable populations. Older people were at significantly higher risk, making nursing facilities a particularly dangerous environment. Bilinski's team prioritized the prevention of outbreaks among elderly patients at Laguna Honda Hospital, a nursing facility operated by the Department of Public Health. Next, the team focused on protecting healthcare workers. If hospital staff were sick, the whole system could be quickly overwhelmed. Schools were closed and libraries and recreation centers were converted into emergency childcare facilities for the children of healthcare workers and low-income families. Finally, the team began an information campaign about mask wearing, social distancing, and hand washing. The goal was to teach people that preventing community transmission should be a priority. As the crisis persisted, Bilinski remained aware of issues surrounding inequity. For instance, Latino and Black residents of San Francisco were hospitalized at a much higher rate. The operations team recognized they needed to improve COVID testing citywide while enforcing the new shelter-in-place orders. A growing mistrust in government meant that public messaging was often ignored. Mask wearing became a political issue. On top of it, dealing with burnout among long-term essential workers and medical staff was a top priority. By early 2021, as vaccines began to roll out and businesses reopened, the short-term crisis was resolved. While the world continues to adjust to the new normal, San Francisco was fortunate to benefit from the Department of Public Health's swift pandemic response. To learn more, read San Francisco Department of Public Health, Leading Through the COVID-19 Crisis by Jennifer Chapman, published by the Berkeley Haas case series.